It's a real pleasure for me to talking to all of you. I wanted to congratulate CAPER for all the nice work that the CAPER Training Committee is doing and CAPER as an organization. This is a really important forum where trainees and junior faculty can come together to share their experiences and also learn from each other. And we as mentors are always available for you for help and guidance as and when you need it. As part of this introduction, I wanted to go ahead with my presentation today, which is on manuscript writing. So let's see if I can. So what I would like to highlight here is this section on mentoring, education, and training corner, which is in gastroenterology each month. It covers a variety of topics focused on these areas. This series started, I believe, in 2011 and has been very helpful. I would recommend you to consider going through the different articles in this series. These are also publicly available. And I want to draw your attention to this article that was published in 2012, which I found to be very helpful. It is a concise review of how you should think about writing and publishing scientific papers. I have over the years used several of the tips that have been provided here. And what I'm going to present today is drawn from this article, as well as conversations and advice from mentors and colleagues. This article also gives you references that could help in the writing style and other aspects. So with that introduction, I wanted to make some general comments. The discussion today will be focused mainly on original manuscripts. That would also include systematic reviews and meta-analyses, because the approach to these two is also fairly similar to a study that you may have conducted and want to publish results. If you have reached to a point where you are thinking about writing a manuscript that reflects culmination of a long effort, which could have lasted for months or several years, depending upon the scope of your research project. And seeing a manuscript in print is a very satisfying experience. Publishing is also important in academic medicine for several reasons. It helps to disseminate the knowledge. It is a marker of your productivity in the field. It is a criteria that is used for academic advancement, like promotions. It is a way for you to get recognition for the work you are doing, and people to know what your interests are. Now, there is always a concern among, especially when you start writing or when you're starting to do studies, as to, whether you have a background to actually write. There are people who may not have, English literature or done in English literature courses. There can be other barriers with regard to culture issues. English may not be the primary language. But what I want to tell you is that scientific writing, it can be learned. And if you practice it and if you work through it over time, it becomes easier to write. There are also several barriers to writing otherwise. For example, especially when you are at a trainee stage or at a junior faculty stage, once you are ready to write a paper, often people can find it difficult to get the first draft. There are other priorities that could be of importance. For example, you may have a lot of clinical workload. There can be family obligations or others that could prevent you from making a start. Often people may think that, they want to get the first draft, the perfect draft. which actually is not the case. The initial goal should be is to get something on paper, then that you can continue to revise. At a trainee or at a junior faculty stage, you will have mentors who are going to be working with you. So, get the first draft ready, send it to the mentor or other, people who are going to be part of your authorship list, and get feedback. This is an iterative process, and there can be several revisions that need to be made before you get actually an advanced draft that would be suitable for sending to the journal for peer review. There are several stages in the timeline, from starting to prepare a manuscript to see the manuscript in print. These typically include a submission to a journal, followed by peer review, and a decision from a journal either to reject the manuscript outright or after a formal review, or need for making revisions. You make the appropriate revisions and resubmit, followed by acceptance, and then review of proofs, and then the manuscript in print. Once your manuscript has been completed and submitted, this timeline could still be highly variable, and it could range anywhere from 3 months to a year sometimes. And often the length of this timeline or duration is dependent upon which journals you have chosen to initially submit, what type of critiques that you have received, how many times you have to resubmit to the same journal or another journal. So it could be a long process. So moving on to what do you do to begin? If you have reached a stage where you are ready to write a manuscript, that means that you've already done the background work of planning a study, executing a study, and you have some results that you have generated. It is expected that you would have already reviewed the literature previously when you are planning your study and setting it up. But you may want to do additional research at this time to ensure that you have gotten most of the references that you would want to include. And this can be refined during revisions that you're doing for your manuscript. This is also a good stage to think about what journal you want to publish your manuscript. Every author thinks that the paper that they are writing is the best in the field, but this may or may not match with what the expectation of the journal is or what the focus of the journal is. So I cannot give you a concrete advice with regard to which journal is best for a particular manuscript, but you may want to read the author instructions and also about the journal as to what type of articles they are soliciting, and also review individual journals or your target journals as to what type of articles they have published in the past 6 months or 12 months. You may want to align what is the content of your paper, what is your paper addressing, and what the eventual readership you believe would be benefiting from your work. The more it is aligned, the easier it is to get your paper reviewed in a timely manner, and accepted. I would also recommend that before you start writing a manuscript, once you've chosen a target journal, to read author instructions carefully, because it will give you an idea with regard to how you need to format your manuscript, what are the different sections, how many tables and figures they're expecting, what is the word count, and several other things that they would need to see. Do they want their references to be included, and so on. This is an outline for what are the typical sections of a manuscript. So you have a title. Title is important because whenever somebody does a literature review, this is the first thing that they see. And often title should be such that it hooks on a reader as to wanting to read a manuscript. The title should also be declarative. It should give you an idea with regard to what the study was about, and maybe give an idea with regard to what the study found. Because if a reader does not know what exactly is in the paper from your title, the chances are that they may not be interested to read, because that's going to take more time for them to figure it out. So a declarative title is very helpful. It should give information about the study as much as possible. Authorship is very important. Ideally, this should be decided upon very early when you are writing a manuscript or considering a manuscript. You should only include authors that have contributed significantly to the different aspects of the study or writing of the manuscript. And I would recommend you to read about specifications on what constitutes authorship. As a junior faculty and as a trainee, often your mentor would be able to advise you and help you in this process. The other sections of the manuscript include abstract, introduction, methods, results, and discussion. And I'll touch upon each of those specifically. One of the other questions which comes up is, in what order should I write the manuscript? Which section should I write first, or should I follow this this order of the manuscript? Everybody has their own style. I usually write the results section the first, and within the results section, I start with thinking about what my tables should look like and what my figures should look like, because that actually can then help you to organize your results, because whatever is there in the results is then going to dictate with regard to how you structure your methods and introduction, and to obviously discussion. But there are other people may have other preferences. So talking about abstracts, move this a little bit. Abstract, after the title, abstract is the most read part of the manuscript. Whenever somebody is doing a literature review, PubMed, they would typically read the abstract as to what is in there. So abstract should include summary of key observations that were made in your study, key methods that were used. Abstract should be standalone. Somebody does not have to go into reading the full paper to really figure out what was done. Abstract usually have a word limit, which is specific to journals. And the abstract could be structured or unstructured. What I mean by structured is that it would have the same sections, background or introduction, methods, results, and discussion, as they are laid out in the full manuscript. Or it could be unstructured, where it's just a narrative paragraph. Your conclusions should address the main aim of the paper. You don't have to include all conclusions in here, but at least the main, how did you address the main aim? And typically I write the abstract the last. And the reason for that is that once you have spent time in writing the whole manuscript, it just becomes a little bit easier to write the abstract, because at that point of time you have a very good idea with regard to not only the methods and result, but how, what is the context of your findings. But again, people may have their own preferences. Sometimes people find it easier to write the abstract initially and then revise it as the paper is coming along. Okay, so somehow I'm not able to. The next section is introduction. The introduction section is where you lay out the rationale of your study. This is not an exhaustive review of the literature. The introduction should be organized into three or 4 sections, and roughly they should be equal length, but that can be variable depending upon the study. The first section should provide some basic information about the topic that you are interested in, or the focus of your study, and some relevant information with regard to that area. For example, the burden of disease. Um, the way, if it is a methodology paper with regard to diagnosis, specific ways in which the condition is diagnosed, and those sorts of things. The second section of the introduction is where you are going into more details with regard to what previous studies have found in this area. You have to be generous with regard to citing references, especially the most important papers that have covered that topic. Obviously, they have to be relevant to the focus of your paper. And then here you lay out the gaps in knowledge or unanswered questions that led you to do what you did. And if it is possible for you to give reasons as to why these gaps are there, that actually is helpful. For example, you could say that if it is a prospectively done study, that prior studies have not used a prospective study design, and you could provide a rationale. Say, for example, chronic pancreatitis, it is a low prevalence disease. That's why it's difficult to do prospective studies. So that actually is helpful to lay the groundwork of appreciation by the reviewers and readers as to your efforts in conducting your study. And then the last section is to highlight as to what your aims of the study are, what was your hypotheses, and how your study addresses the gaps that you identified in the previous section. A hypothesis-driven study is always helpful to get published. And the reason is that often you review papers where the authors indicated that their aim were, they outlined their aim, but when you actually really read the results and the discussion, they're talking about many different things that were not even the focus of the paper. So in an individual study, I believe that 1 to 3 specific points or new ideas or information is enough. Your study does not have to answer all questions about a particular topic. So that's very important to remember. Now, the last 2 points that I made here are something that is, variable with regard to whether you would want to include or not. For example, you may want to include in the introduction itself the unique aspect of the data set, or the way you approached a study or methodology that actually advances the field. You could also summarize your observations in 1 or 2 lines so that the reader or the reviewer is ready to then go on to the next section and expect what you would go over in more detail. Now, these 2 points, as I said, is they are optional because you are going to discuss them in the methods and results. But I have seen that good papers often would include a very short paragraph about this. The length of the introduction typically should be 1 to 3 double-spaced pages. As I mentioned initially, it should not be an exhaustive review of the literature, but more focused review. The next part of the manuscript is the method section, which I believe is the most important part of the paper, because this really outlines as to what you did, how you did it, how you made the observations, what was the rationale for you to choose some things over the others, how did you approach the statistical analyses. This is the section which is very carefully scrutinized by the reviewers. And then my suggestion is to consider organizing your methods section into headings and subheadings, which makes actually writing of the methods much easier, because then you know which part of your method should go into which section. I would also recommend that you write the statistical analyses and results in the same flow as you have written the methods, so that when the reader or the reviewer is reading it, they know exactly how they are going. The next sections are going to be displayed in your manuscript. Write up your method should allow reconstruction of the conduct of the study. So a reader should be able to get a pretty good idea with regard to how the study was done. If you are describing about experimental methods, it should either have references to the original papers or more detailed methodology with a summary that you're providing, so that somebody could actually go back and do those experiments and replicate the results. The method should have sufficient details both for an average reader as well as for somebody who wants to get more nuanced information about methods, people who have a specific interest in that particular topic, so that they can find that information. You have to remember about avoiding redundancy. And then it is always a good practice to provide explanations when relevant. So often, when people are writing a manuscript or method, they say, "Oh, I'll discuss this thing in the discussion." But often it is important to include why you chose a particular approach right there in the method, so that the reader or the reviewer can follow along with you the rationale of doing it, rather than waiting for the results section or the discussion section to find that information. You should consider using tables and figures smartly to convey your message. For example, if you have complex definitions and multiple definitions in your paper, it may be a good idea to include a table which outlines every single term that you used, what was the description or definition for that term, and then the interpretation that you're going to use in your manuscript or results using that. If there is you could include a flow chart with regard to how your study population was eventually selected from a broader population. Why were certain patients excluded? This is what a consort diagram does, and it is very helpful, because then the reader does not have to go to your methods again and again. They can just go to the table or the figure to grasp that information. Statistical section typically is part of the method section, but I suggest that you organize this from basic comparisons to more specific or refined analyses that have been performed in your study. You should state comparison groups clearly and provide explanation for performing certain specific comparisons. Again, similar to methods, it is a good idea to provide explanations right there rather than doing that in the discussion section. And once you go beyond simple two-group comparisons to, for example, multivariable comparisons, it is a good idea to indicate there what was your outcome variable of interest, what are your predictor variables of interest. Hopefully, if you have not already described the importance of this in the methods, you may want to lay out as to why did you think that these predictor variables were important for you to include. And then there are certain other relevant information, for example, whether you looked for interactions or not, whether there was collinearity within the different variables or not. It is good for you to include that information so that the reader or reviewer knows that you understand those concepts and you have gone through those steps. You may want to state as to how did you assess for statistical significance in your data. The next section is the results section, which is the most read section after your abstract. It is also the meat of the paper. This is where all what you have done is crystallized or synthesized to provide it in the most meaningful manner to the reader. I suggest that you organize the results also into sections that have headings and subheadings. The layout which is similar to how you have laid out your method section. The result should be clear and concise. Avoid redundancy again here. You should use tables and figures to display the data because they help you to make the results more succinct without losing too much details. And figures can actually be very helpful for you to convey complex information for easy interpretation. So if you are trying to show differences between groups, a figure can actually drive the message a lot more easier as compared to text information. Or if there are complex concepts, representing that in a figure may make understanding for an average reader much easier. When you're writing the narrative section of the results, I suggest not to repeat the information from tables and figure as is. You don't have to keep on repeating all the numbers and standard deviations and p-values, but rather you have to try to interpret the data for the reader as to what exactly the data is showing to you. This may be helpful to put the results in context. For example, when you're discussing about odds ratios, rather than just stating the odds ratio was this, it may be helpful for you to actually go into more details as to, as compared to this group, the odds of having smoking were 2.4 times greater in your group A versus group B, or whatever it may be. This may be easier for the reader to grasp the information. Now, often citing literature from prior work, your own work or from other people, is not really needed in the results section. Results section is primarily focused on what you found in your study. But in some specific situations, you could reference or you could compare your work with others in the results section, but that's usually not the norm. Tables and figures are very helpful because you can provide, you can put a lot of details in tables and figures and show comparisons between different groups in your study population. I also already touched upon figures can help you to visually convey differences between comparison groups and show complex data. Now, the tables and figures should be standalone. What I mean by that is that the title of the table should be informative. It should give information on what was your study population, what exactly you are trying to show in the table, and maybe include what groups you are trying to compare if you're showing comparisons, and if relevant, the time frame for the study. The figure legend should have appropriate details for, if you're using abbreviations, if there is missing data, if you have to provide definition for groups so that the reader does not have to go back to your methods again and again. And then interpretation of specific observation of relevance. That means that if your figure is trying to show a concept, the legend should actually describe what that concept means in a layman's term to make it easier to understand that. You should also always check the author instructions with regard to not only the number of tables and figures that are allowed, but also how they would like the tables and figures to appear and what information is needed. Now, these days, journals are liberal with regard to submission of supplementary data. So if you have additional data which are not the core part of your manuscript, you could include that data as supplementary data and only show the things that are the most relevant in the main manuscript. This brings us to the discussion section. Discussion should be very focused. Again, you are not writing a review article. You are trying to use the discussion to frame the results of your study and compare them with what has been done in the literature and how this has helped you to advance the field. Uh, so it should highlight the most relevant observations of your study, how these observations compare with and add to published literature, what are the strengths and limitations of your study, what are the areas of future research based on your work, and what are your conclusions. You have to keep discussions succinct, um, typically 2 to 5 pages, and 5 is also a liberal. Now, basic science papers sometimes can have longer discussions, but typically 2 to 5 pages is what the length of the discussion section should be. Um, the first paragraph of the discussion section should summarize your most important observations. And as I had mentioned previously, you should have only 1 to 2 or maybe 3 main messages, core messages. You have to identify what are your core messages in the paper, and then you need to state them in the first paragraph. And then your subsequent paragraphs should elaborate each of those points. And when you're elaborating those, you need to then go back to the literature as to what people have done before. You may want to include relevant details of what their observations were and how they compare with the observations in your study. How are they similar or different? And what does that actually mean? And then you need to cite relevant references from the literature and interpret your prior work and how your work adds to or expands those prior observations. You need to then include what are the strengths of your study, how your study has actually advanced the field and addressed the gaps in knowledge, and then limitations. I believe limitations of your work is a very important area. It is often, in many papers, it is not appropriately written, or written. The authors don't go into the details. But I believe limitations should be a good part of your discussion section. And as you outline the limitations, it is always good to then say that, oh, we tried to overcome the limitations, but this is why we could not overcome the limitations, so that the reader and reviewer can understand as to, oh, yes, you did your best, but this is just where the state of the science at this time is. Now, I believe that one of the common mistakes in manuscripts is that the authors often overread or overinterpret the data, and they draw conclusions based on things that are not supported by the data. This is something that you have to be very careful, because often this could be one reason why your manuscript has been rejected from a journal, because you're trying to say things that just don't make sense and your data does not show. Lastly, I recommend that you use a reference manager. Whatever your institution supports, this just makes it easier to develop a bibliography. So now that you have gone through the process, you have written a paper, what next? The next step is submission of your paper to a journal, which most of the journals now accept online submission. You need to prepare a cover letter. This cover letter should highlight or summarize what exactly was done in your study and how do you think that this is going to be helpful for the readers for this specific journal. Once you have submitted the manuscript, it is typically reviewed by an associate editor for a rapid review, and then the associate editor would make a decision whether the paper is aligned to the focus of the journal or not, and the importance of the paper, and then make a determination whether it should be forwarded to reviewers. Typically, the manuscript is sent to 2 to 3 reviewers to get feedback, and this process can take anywhere from 2 to 8 weeks. If the process is taking longer, it is not a bad idea to send a reminder to the journal about to inquire about the status of your manuscript. So this is what is going to be the most typical scenario, or often you will have this scenario where your manuscript is rejected. it can be rejected in two ways. It could be a desk rejection. So within a week of your submission, or within 2 or 3 days of your submission, you get an email that, sorry that, we are not going to be able to accept your submission. Don't get discouraged. As I mentioned initially, the better you're able to align the content of your paper to what the readership should be, the less likely this is going to happen. But if you get a rejection like this, you just submit it to the next journal on your list. Often the rejection could occur after the paper has gone through a formal review process. When you get that back, take a deep breath. Don't get worried. Don't get frustrated. Take time to go through reviewer comments carefully. You need to take the criticism constructively, because chances are that the point that the reviewers have made, it makes sense and they are correct. You need to try to address what you can. Perform additional experiments or do additional analyses, whatever is reasonable or possible that you could do. And then revise and submit to another journal. If you do that, and you may get a rejection, but a rejection with hope, which is actually great news, because that means that the journal is interested in your work. And if you are able to appropriately address the concerns for the reviewer, there's a reasonable chance that the paper may get accepted. And then you go through the same exercise by going through the reviewer comments. You address their critiques as best as you can, and then you resubmit your manuscript. When you're preparing your revision for submission, you should always write a cover letter. And this cover letter should include responses to reviewer comments, which should be point-by-point responses as to what you have done to address the reviewer comments. If you have done additional analyses, you include that, whether you included that information in the manuscript or not, and how much did you include, where did you include. All of this information needs to be included in your response. You have to be polite. You have to be thankful for things that the reviewer said or they have indicated are good with your paper. But you also have to, you may not be able to answer all their critiques just because you don't have the data, or you may not be able to do that type of analysis or experiment. So if you do not have data, you cannot perform certain analyses, you should acknowledge that. Or if you think that it cannot be answered, you can acknowledge that too. You have to respond in a timely manner. If you feel you're going to be delayed, you need to write to the journal and ask permission for getting an extension. And finally, your manuscript gets accepted, so congratulations. All your hard work has paid off. You are going to then be receiving the proofs of the manuscript, typically in 2 to 4 weeks after acceptance. There are going to be certain queries that are going to be included in there that you need to address. So review your manuscript carefully. Ensure that there are no omissions or errors that are there in addition to the queries that have been sent to you. You address them and send them back, and then your manuscript is going to then be published subsequently. So this is all what I have, and I'll be happy to answer any questions.
All right. Thank you, Dr. Yadav. That was an excellent presentation. This will be a good primer for us trainees to help with manuscript writing. We have around 15 minutes more, and we will take questions from all the participants. And each participant, you can unmute yourself and ask the question. So I will begin with one question regarding the selection of journal. How do we decide what journal we should consider for our publication?
Mm-hmm. So again, as I had mentioned earlier, it's going to be difficult to give you a definitive answer, but I can give you certain pointers. So we always want to send our journal to the highest or our paper to the highest impact journal, right? But say, for example, the top journals, say in our fields, say gastroenterology. If you really look at what gastroenterology is publishing, they are publishing novel observations in your area, or a new way to do or evaluate things or treat things that changes clinical practice immediately and has a significant impact. When it is looking at translational projects or basic science projects, again, the metric is the same. How does it change the status quo? So that's the criteria they are using. If you have a paper say, that is very focused to your field, for example, if you have a paper that is talking about, say, prevalence of chronic pancreatitis in a specific population, this is an important topic, but it may not be something that may change the practice. And it also depends upon whether this information has been published or not. So if this type of paper may be more useful for a content-specific journal like pancreatology or pancreas. So the way that you can think about is you have done your study, you have your results. Why are these results important? And if so, who are the people it is going to be most important for? Does my study have novel observations or not? And if so, whether these novel observations are relevant for an internist, like a broader readership, or it is more aligned towards therapeutic endoscopists, or those sorts of things. So those are some of the criteria that you can use to think about what journal to send the paper to.
Thank you. That makes sense. And we can take questions from the rest of the participants now. Jamal?
Yeah, Dr. Yadav, great talk. Thank you so much. Perfect overview for actually young trainees. So usually when we especially work with our residents, fellows, or as young trainees, we don't have very high impact publications. Usually we start with retrospective small site studies, and those usually go to low impact journals, and we may get rejected or ask for major revisions in regards to the type of manuscripts, because if you go, some of them, they say they're open for original manuscripts. Some of them are for reviews. Some of them are for case reports. Some of them are for letter to the editors. If you send a journal manuscript for an original research and they think it's really low impact and that it doesn't deserve publication, but they advise that they can publish it as a letter to editor. So what is the difference? Will in your view, try to publish a paper that is really low impact, would you try to publish it and move to the next project if you think it is not really priority and doesn't have high impact, or would you try to still address the comments and spend extra time?
Yeah, so this is relative with regard to how do you approach. Obviously if a full manuscript always has more weight as compared to, say, a letter to the editor. But it also depends upon what journal you're trying to submit it to. So, for example, getting something published as a letter to the editor in a very high impact journal actually has a lot more weight than if you're going to publish, a manuscript in a journal with lower impact. So I think you have to look at what exactly is the content that you're trying to publish. But in general, if and it also depends on what your study focuses on. But if a high impact journal is asking for a letter to the editor, that means they recognize the importance of what you have done. And then, that may not be an unreasonable consideration. I've done it, sometimes where I published it as a letter to the editor. Yeah.
Dr. Yadav, as a follow-up to that question, so in between the letter to editor and the full publication, there are also this brief communication type of publications, like all these journals, CGH, Gastro, Red Journal, all of them accepted. How different is the impact for a brief communication compared to a full length or a conventional full publication?
The brief communication, I believe, is the same as an original manuscript or a full manuscript. What my understanding is that the brief communications actually there's a rapid turnaround for a brief communication with regard to review and eventual publication. And the brief communications typically are geared towards something which is novel that you are trying to publish. So that's what there is a word limit. Brief communications typically are much shorter than a full-length manuscript. So you have to keep that in mind. And I believe the selection for brief communication, unless it is solicited, is more difficult because there's going to be more competition with regard to acceptance. But it's a novel observation or a mechanism or treatment, that sort of a thing.
All right, it's open, so you can unmute yourself and ask a question if you have any. So Dr. Yadav, in the meantime, I have one more question. Regarding authorship, again, from the trainee's perspective, authorship is definitely important, but how important is it regarding the sequence of where your name is coming up in the authors list, like first author, second author, third author, so on? And how do we bring up this discussion with the mentor? Like, how do we approach this?
Yeah, that's actually a very good question. I think the discussion for authorship should occur as early as possible. In fact, as a trainee, I would suggest that this occur when you're starting to work on the study, depending upon distribution of efforts for the conduct, the planning of the study and the conduct of the study and analyses. So for example, if there are 2 or 3 people working on if for example, if a trainee is the primary person who's working on the project and has carried out the most parts of the project, the trainee would often or obviously would be the first author, and the mentor would be the senior author in that publication. Now, if there is a situation where the scope of the project is broader, and then help for other trainees or lab members have helped in completing the project, a discussion earlier on, before the manuscript is written, or sometime during the conduct of the study is a good idea. The mentor would also have based on their experience, an idea with regard to whether this particular study is going to result in one publication or more than one publications, again, depending upon the scope of the project. And then if there are more than one publications, depending upon what is the focus of the individual paper, there could be shared co-first authorship that could be considered, or if the study is focused more on clinical aspects, that's where the trainee has worked on. In that manuscript, the trainee becomes that particular trainee becomes the first author. And if, for example, there is a translational aspect to another paper based on that data, then the translational person could be the first author and the trainee becomes the second author. So it all depends upon how much work has been put in by who in the study team that determines. But the earlier this discussion happens, the better it is.
I have a question. This is Adrienne Sen here. I know this is probably an important question among trainees because we have such limited time to publish articles and it takes so long to publish. What are your thoughts, considering how long it takes for a journal to publish your article? What are your thoughts about trying to or submitting a manuscript to multiple journals at one time in order to expedite publishing?
That is an absolute no. You cannot submit the same manuscript concurrently to more than one journal. In fact, your cover letter should include a statement that the manuscript that you are submitting to the journal is not currently under consideration by any other journal. Unfortunately, that's just how it is, because, and this is important because, you cannot expedite the process, by submitting it to multiple journals. All right. Any other questions?
Thank you, Dr. Yadav. This was a great presentation and a good discussion. And we will also record this and host on present this on our website. And thank you for taking time on your weekend for giving this presentation to us.
Yeah, and just in closing, I would say is that, if anybody of the CAPER trainees have questions, they want advice, feel free to email, call. Not only myself, I can also say on behalf of many other colleagues of mine who are participating in training for fellows and junior faculty, they would be open to helping out as much as possible, not only for manuscript writing, but also for, if you have questions with regard to studies you are doing, study design issues, or others, feel free to reach out to us, and we will help as much as we can.
Thank you, Dr. Yadav, and have a nice rest of the weekend.
Okay, you too. Thank you all.
Thank you.